Hi, and welcome to the How to Survive Healthcare podcast. I'm your host, Kayla Thompson-Riviere, seasoned critical care RN turned independent patient advocate. Tune in every week so that you can learn the things about the U.S. healthcare system that no one ever tells you. That way that you can get the most from it and optimize your health outcomes. Now, of course, this podcast is strictly to inform and entertain and should never be taken as a substitute for medical advice. Let's dive right in. Hello, welcome back to the podcast. Today, I wanted to talk to you about the state of healthcare right now in 2024 and really why advocacy is so critical, ideally, within the form of an independent patient advocate, clinically trained. However, I know that's not within reach for everyone. And I want to take this moment and really encourage you to pause and reflect and see who can be the advocate in your healthcare journey. And we're going to talk about why. So, what is advocacy? I'm not sure I've actually fully explained this on the podcast before, but the core concept of advocacy is to be the voice for the voiceless. Now, not every time you are voiceless. However, engaging with the healthcare system is a very disempowering experience from the get-go. You're working with a provider, usually a doctor, sometimes a nurse practitioner, or a physician assistant. However, whoever that provider is, they have many degrees and many years of training, and they are regarded as the expert in all things medical that you're going to them for. Now, that being said, of course, while we value their intelligence and their training, we also know that they're human and they don't know everything. And there is always a period of time between when symptoms or problems start to arise with your body and when you actually get a diagnosis and we figure out exactly what's wrong with you. And then there's also a transition period of figuring out the right plan for you. You know, there's a reason why it's called practicing medicine. And that's because it's not a one size fits all. Unfortunately, in healthcare today, a lot of things have, I venture to say, I'd actually say most things have been kind of boiled down to a one size fits all approach. We have protocols for disease processes and how they should be treated. And there's good and bad around that. It does help to prevent a lot of oversight, but unfortunately, a lot of people get kind of just put in this protocol, and then the actually looking at what's actually for that specific person and their unique situation, that element can kind of get lost very quickly. When you couple that with the fact that healthcare has just become an absolute struggle and battle for resources, you can start to see pretty quickly why things kind of slip through the cracks or, fall off the radar screen, so to speak, different aspects of your care. In the world of independent patient advocacy, I would like to just take a moment and point out that there are actually different facets. So with my decade background of nursing experience, I am a clinical advocate. So I help people through figuring out what's going on with them medically speaking and help them to understand it and determine the right care of plan moving forward and assist with getting them through figuring out who they need to talk to, what door needs to be opened, what can of worms, and using the can opener sometimes. However, there's other facets to the healthcare system, right? Billing and insurance is a huge one. Now, that's something personally I can handle some small things, but I'm certainly not the expert in. But we do have those experts in our field. There are many people who are billing and insurance independent patient advocates and will help you understand your insurance, get the right plan, and negotiate bills, understand what it's even saying. Fun fact, it's somewhere around, don't quote me, look it up, but somewhere around 80% of medical bills that you receive in the mail have an error on them. So don't ever just pay a bill flat out. You got to look into it first, and that can get kind of overwhelming. So we do have medical billing experts. If that's something that you're looking for, reach out and I can connect you. Also, I have mentioned before, I will be having a permanent co-host on the show now, Nicole Broadhurst. She'll be coming in a couple of weeks, and she is a medical billing expert. So very interesting. She'll be able to bring the financial aspect to things, but I digress. A couple other just little points though about advocacy. I get a question a lot of times, people ask me, is this just for when I'm in the hospital? And truly the answer is no. And you've probably heard the term before, an ounce of prevention is worth a pound of cure. So when I have the privilege of working with clients in before a hospitalization, when they're in a little bit more of a stable phase, that's really when we can do the most beneficial work, because we can start to kind of pick apart what's going on with them medically and identify some of the gaps in their care plan, and then start to recreate a plan around that to address those areas and fix them so that their medical conditions get managed more tightly and avoid hospitalizations. So that's one aspect of what I do, where though this is a paid service, working with an advocate like myself can actually help you save money, because you can avoid hospitalizations and complications, which, and of course, not only from the financial aspect, but who wants to go to the hospital and get really sick? Obviously, no one. So that value is there as well. Healthcare, though, I liken it a lot to, you wouldn't go to court without a lawyer. Unfortunately, we're at a point now where our providers across the board are stretched so thin that I wouldn't recommend engaging in the healthcare system alone either. You really should have an advocate. Again, ideally, a clinically trained advocate, someone like myself, but at least somebody in your life, a spouse, adult, child, or other family member, or a really close friend, and ideally the same person every time, so that they can start to generate an understanding of your condition and really be kind of a team player with you, to help you try to figure out all of these things as you're moving through on your own. And you can also return the favor to them and be their advocate at their side, so that when you are going into the doctor's office or the hospital, and you maybe don't have a wide breadth of clinical experience, or honestly, I can tell you firsthand, even if you do, when you are scared and in pain, unsure about the future, struggling with the implications of what's going on with you, just flat out not feeling well, and then you could think back to that power, that kind of power, uneven power dynamic that I mentioned a few minutes ago, with this provider who has all of this extensive training and is regarded as an expert. It kind of tilts the scales, so you end up feeling, whether you realize this consciously or not, you end up feeling like the provider is kind of above you, and it creates this dynamic where it tends to be whatever they say goes. And a lot of times patients are left feeling like really a passenger on this experience, when it is your healthcare experience. You should be the one in the driver's seat. I like to share that doctors and other providers, you're not stuck with them. This is like a hire fire situation. So if they're not working for you, you have the power and the authority to quote fire them and move on and find somebody who is going to listen to you, respect you, and really be more of a team player in figuring out what's going on with you medically and your treatment options. So now I think it starts to become a little bit more clear why having another person with you, ideally somebody who is also an expert in the healthcare field, can be such a powerful tool in surviving healthcare. It becomes particularly crucial, though, when you have either complex, rare, or multiple medical conditions, because it makes those scenarios make getting through healthcare even more challenging because there's complexity interwoven, especially once you start getting into 4 or 5 different physicians that you're seeing, and oftentimes they don't communicate together well. They kind of tend to just dump everything onto the patient to make sense of how it all fits together. Having a clinically trained advocate can really help you to understand how all of the things weave and work together for your one body. Furthermore, people like myself, I like to say one of my superpowers is I speak doctor. I take that jargon that you often hear from your providers and really bring it down to basic level, plain English, and put it in ways that you can understand. For instance, I love to when I have patients who have something wrong with their heart, like congestive heart failure is something we see a lot in the population. Uh, a lot of people don't understand what that means or what that means for them. And I like to share that the heart is a pump. Truly, that's all it is. It's a pump and it's circulating around the blood. And when we have congestive heart failure, the pump is weak and can no longer manage all of the fluid that it has to pump. And that's why we're prescribed diuretics, to help to get the fluid off so that it's not as hard on the pump. So those kind of like simple explanations, it really makes a difference for understanding what's going on with you, and then understanding why the treatment options are being presented, and then to be able to start to figure out what is the best treatment plan for you. Because another aspect that I've seen a lot over my career is, again, how I mentioned, patients end up feeling like they're sort of a passenger on this healthcare journey. And sometimes you go to the office and it may feel like the doctor or provider is just telling you what you need to do, without first taking into consideration what your goals for treatment are. Typically the default mode of thinking is we are going to do everything we can to manage this disease or illness as tightly as we can to mitigate further issues and really prolong life. That tends to be the goal. However, for every one of us, there will reach a point where we are doing so many things to manage this illness. Typically, this is with chronic conditions, especially when, again, you've got multiple of them coming into play, that there typically becomes a point where we really should stop and ask ourselves if it's affecting quality of life, to what extent, how much that weighs in importance, and start to talk about quality versus quantity. And those kinds of discussions, I have found, often don't get brought up with medical professionals until the patient has unfortunately gotten to a point where we're concerned that perhaps they are near the end of their lifetime, really close to the end, and now we start to talk about medical futility. However, I mean, how many people do you know that they ended up the last year or two of their life, they were just constantly in and out of the hospital? And that's a really important discussion about, okay, all of us, our time is limited. We should look a little sooner than the absolute end of life to discuss what that quality of life is going to look like. So that's another thing that us advocates like myself can help to facilitate that kind of conversation around, and be able to bring it back to your provider during those office visits and start to tweak your care plan to really, maybe we can manage it at 75% of what we were doing and get you a lot more quality. So you're still looking at a longer time frame, but now in a way that fits your goals of life better, and without you having to guess what you're going to pull out. Like I see this a lot. What's coming to mind is diabetics. People who have pretty significant diabetes, you may be aware, ought to, oftentimes, are prescribed to check their blood sugars, usually 4, sometimes 5 times a day, and treat themselves with insulin for that. For a lot of people, it gets to a point in their life they don't want to do that anymore. And that can be a difficult conversation to have with the doctor who manages your diabetes. And so a lot of times what'll happen is the patient says, I don't want to do this. And then they don't do anything. And then their diabetes gets out of control. And then they end up with a hospitalization from it and potentially permanent damage to, there's a lot of organs diabetes affects. So then where the pendulum is swinging so far the other direction. And in addition, then they get labeled as non-compliant. So then any new provider that they're going to work with, they have this label of essentially being a bad patient who doesn't want to do what the doctor is saying. And it's just a terrible dynamic that we can avoid, because what you want out of your life and how far medically involved you want to be, that's a choice. And that's a choice that your doctor can't make for you. I can't make for you. The only person who can make that choice for you is yourself, or technically your medical power of attorney if you're no longer capable of medical decision making, but that's another conversation. But again, often that entire spectrum of choice isn't presented, especially not in what you get maybe 10 minutes with your provider if you're lucky. So these are, again, some of the more of the things where advocacy just becomes so crucial. Furthermore, people like myself, we can help you with all of the nonsense of healthcare, the phone calls, the paperwork, the going back and forth. I wish I had somebody, a clone of myself, really. I could have dealt with this. I just switched pediatricians for my kids. It was such a process getting the records faxed from the old pediatrician to the new one. Part of the reason we left our old pediatrician, because dealing with their office was always such a struggle. I didn't count how many times I had to call that office and also fax the paperwork multiple times. But the new office that we moved to, that I was calling to arrange all of this, I finally went back through my phone records. I had to call them 18 times before I was finally able to make an appointment. And this is calling to see if they had the paperwork, to figure out what the next steps are, and then also going back to the other pediatrician. So that's just an example of an advocate can do that for you so that you don't have to do it. So you can just focus on getting better and focus on your health without all of the administrative riffraff that often goes along with healthcare. Lastly, working with an advocate helps to provide a level of peace of mind and comfort and security that unfortunately you can't get in any other avenue of healthcare. When you work with somebody who is, I've I've mentioned before, part of the power of independent patient advocacy is that we don't work for the doctor, we don't work for the hospital, we don't work for the insurance. It's a self-pay service. So, but what that means is I work for you and I am loyal to your needs, regardless of whatever bureaucracy or red tape is going on with this doctor and that doctor and the insurance and this healthcare system. But maybe you're looking at this system now. None of that matters to me. I'm here to serve you and find you the best outcome, regardless of where we have to go, who we have to talk to. I'm committed to getting you on your healthcare journey. And you don't get that from, there's patient advocates in hospitals and insurance companies, but at the end of the day, those people work for the hospital or the insurance company. So while they can be helpful to patients, there's really a significant limit to the type of help that they're able to provide. And unfortunately, it's often tainted by their loyalties to their employer. For example, if you if you call your insurance advocate because you're having trouble, for instance, getting a medication that you need approved, they're probably going to spend the time on that conversation trying to explain to you why what the insurance has chosen is actually the best route for you. And that sometimes maybe that is a good route for you, but again, that should be your choice to make, not somebody telling you why it's the right choice for you. So that's, again, the impartiality. Is that a word? I think I just made up a word. But an advocate being impartial to the service options and, really just being able to focus on you and what you need. I mean, just it's priceless. That is what you need to really get your best healthcare outcomes. So having somebody be able to fight for you and, again, help to be able to reduce your stress of getting through the healthcare system, priceless. So this was, I hope, of just not so brief overview of why I do the work that I do and really the power of advocacy. And again, if you're looking for this kind of support, please reach out. You can comment or reach out to wherever you're hearing this podcast, or you can go right to my website, www.heardforlife.com. That's HEARDFORLIFE.com. And again, if you're not in a position where this kind of advocacy is accessible, I hear you. And I am working on that, trying to address the accessibility factor. Because again, as I mentioned, it is a self-pay service, and in this economy, I get it. There are some free resources. The Patient Advocate Foundation is one, but they aren't able to provide the one-on-one advocacy service, which is really where the magic happens. So again, I would encourage you to really take the time to figure out who is that one person in your life that can commit to walking this journey with you and, helping you prepare for your doctor's appointments, going to those appointments, standing by your side to help you fight for your healthcare needs. I've said before, the doctor or provider may be the expert in the medical condition that you have, but you are the expert in your own body and your life and what works for you and what does or does not feel right. And that's a really important piece that often without an advocate, without somebody by your side, can be overlooked very easily. So I hope that this was helpful. If it was, please share it with somebody. Wherever you're listening, I would love if you would like and subscribe. It sounds cheesy, but it does help the programs to understand that this content is valuable and to show it to more people so that we can help get the word out about how to survive healthcare. So thanks for listening, guys, and take care. I will see you next week.